So, today I'm going to discuss a topic that you will miss while reading endocrinology, that is hypocalcemic tetany or hypoparathyroidism. See, what is the definition of tetany? Due to reduced levels of ionized calcium in the blood, there will be increased excitability of the peripheral nerves in our body. So, as a result of this increased excitability of the nerves, what happens physiologically at the level of nerves, what happens to the action potential, there will be partial depolarizations of the nerves and muscles because of decreased threshold potential. That means at low threshold itself, the nerves and muscles in our body will start exciting. And this potential will come very close to the resting membrane potential, so that even a small stimulus will excite the nerves and muscles. Coming to what are the causes of tetany, hypoparathyroidism is one of the causes of hypocalcemia, and hypocalcemia itself is one of the most common cause of tetany. So let us see what are the causes of tetany. It is mainly because of hypocalcemia. So as I told, it may occur as a result of osteomalacia, defect in absorption from the GIT, hypoparathyroidism. In acute pancreatitis, okay, there will be hypocalcemia. Then there are other conditions in which there is increased alkalosis in our body, as in case of hyperventilation, repeated vomiting, primary hyperaldosteronism, so called as the Conn's syndrome, okay, CONN, Conn's syndrome. It is primary hyperaldosteronism. In all these cases, what will happen? There is a decreased calcium level in the blood because the free calcium will bind to albumin. Okay, so the level of ionized calcium in the blood will be decreased. So these are the causes of tetany. So it may be either because of alkalosis. What are the causes of alkalosis? I have told you: persistent vomiting, hyperventilation, primary hyperaldosteronism, or it may be because of hypocalcemia, whose causes are acute pancreatitis, hypoparathyroidism, defect in absorption, and osteomalacia. Coming to an entity we call it a pseudo-hypocalcemia. Pseudo-hypocalcemia means the calcium levels are normal, but in lab it shows like the calcium levels are decreased. This is mainly because of decrease in albumin. Since the albumin levels are low, as in case of severe hypoalbuminemia or in nephrotic syndrome, since the albumin levels are very low, the calcium level, because calcium always binds to albumin, so the calcium level appears to be decreased. That is called pseudo-hypocalcemia. So on adding albumin into the blood, the calcium level comes to normal. So coming to the clinical features of tetany, it is characterized by stridor, then carpopedal spasm and convulsions, mainly in children. Okay, convulsions, stridor and carpopedal spasm are the clinical manifestation which occurs in children. Whereas in adult, we have the so-called as tingling sensations of the hands, feet, okay, perioral numbness. This is one of the characteristic and initial classical symptom the patient will be saying in wards. In surgery, okay, if the surgeon has removed the parathyroid glands after thyroidectomy, the patient will characteristically complaints of perioral numbness as an initial symptom of hypocalcemia. Okay, remember we have two classical signs. One is called as Chowstock sign, that is after taping the facial nerve distribution, there will be contraction of the muscles. Small stimulus, okay, itself will excite the nerves. That is what I have mentioned in the first of this video. The second thing is called raising the BP cuff. Some 10 to 20 millimeter mercury above the systolic blood pressure, there will be flexing of the wrist. This is called as carpopedal spasm, which occurs in severe hypocalcemia. Okay, mild to moderate hypocalcemia, this won't happen. Then coming into, so these are actually what is tetany, hypocalcemic tetany. Then coming into primary hypoparathyroidism. So hypoparathyroidism is one of the causes for hypocalcemic tetany. So what all happens, or the clinical findings in primary hypoparathyroidism? Of course, hypocalcemic tetany happens. Okay, there will be candida infections, cataract may happen, there will be calcification of basal ganglia. Calcification of basal ganglia is one of the radiological imaging findings in case of primary hypoparathyroidism. What are the laboratory features in case of primary hypoparathyroidism? The calcium level will be low, parathyroid hormone will be low, phosphate levels will be high, then alkaline phosphatase will be always having a normal value. So how will you treat a case of acute hypocalcemia? Immediately give injection 10 ml calcium gluconate, because severe hypocalcemia can lead to what? Yes, fibrillations, ventricular fibrillations. The patient may get tachyarrhythmias. The patient may end up in cardiac arrest. Don't wait and watch an episode of acute hypocalcemia. Immediately inject what? Calcium gluconate in case of evident signs. Okay, if the signs are not evident, take an ECG. In ECG, you can very quickly pick up what? Hypocalcemia. After getting an ECG, if you see any findings of hypocalcemia in ECG, you can go for injection calcium gluconate. Severe hypocalcemia, we have to do saline hydrations, because if in persistent vomiting is one of the causes of severe hypocalcemia. As I told you, in case of alkalosis there will be hyperventilation, or in persistent vomiting first we have to give IV saline. So first we will correct the acid base disorder, and after that we will go for injection calcium gluconate. Okay, so this is how you have to approach a case of acute hypocalcemia.